Yes, thank you very much. And hello and welcome to all members of the board. This is Michael Redlinger, Associate Transportation Planner here at SRTC. And I'm here to talk to you today about equity as part of our transportation discussion series. So that should be agenda item 7 on page 12 in your packet. Apologies. Just a reminder that the purpose of this series is to provide an opportunity for the SRTC board and committees to provide feedback and generate dialogue on some of these topics as they relate to criteria associated with the unified list for regional transportation priorities. At the end of this presentation, I'm going to be asking you a few questions about equity and how it should be measured. But before we get there, last year, as some of you might remember, SRTC assembled a unified list of regional transportation priorities, including many of our priority projects for the region. Here's an example of our list from last year, 2021, and you can find this on the SRTC website under the SRTC board webpage. At the bottom of the page, there's a link to the 2021 unified list, including projects and criteria that were used to develop the list, as well as emphasis areas that the projects address. So, and here's that list of criteria for the unified list, which includes economic vitality, maintenance and preservation, operations, stewardship, quality of life, safety, as well as emphasis areas at the bottom, equity and climate change. So as you know, SRTC is running this discussion series throughout the year. Last month, you heard from Kylie on stewardship. Next month, you'll be hearing from us on funding, and I am here to talk to you today about equity. So some of you may recall, we asked the board and committees for some feedback on equity earlier this year, this winter. We asked you to order and prioritize some different statements around equity planning. And from those polls, we noticed that access to opportunity and services, as well as health and safety benefits, rose to the top as priorities, along with the need to make Spokane a better and stronger community. Those are all great motivations for this work, and we hope that those are reflected throughout this presentation. So what is equity exactly? Equity refers to the fairness with which impacts such as benefits and costs are distributed. For planners, the APA defines equity as a just and fair inclusion into a society in which all can participate, prosper, and reach their full potential. In transportation, it's important that people of all backgrounds, all income levels, disability statuses can all access the full benefits of the transportation system, including safe access to important services, employment, and quality of life destinations. With equity in transportation planning, it's also important to mention the focus on counteracting and countering a legacy of discriminatory planning policies. So MPOs are, of course, bound by Title VI, which requires us to ensure that everybody is included and nobody's denied benefits from any project or program receiving federal dollars along the lines of race, income, national origin, as well as the ADA, Age Discrimination Act, and a host of other foundational laws that all came out of the civil rights era. There are also executive orders which prescribe actions to address environmental justice, notably under the Clinton administration in 1994 and 2000, and then again more recently under the Biden administration. Key environmental justice principles are to avoid, minimize, and mitigate any disproportionate health and environmental impacts, to ensure full and fair participation, to prevent any denial, reduction, or delay in the receipt of benefits from our transportation system. More recently, the Biden administration also established the Justice 40 target to distribute at least 40% of the overall benefits from federal investments into climate and clean energy to disadvantaged communities. So for the first time, USDOT has centered equity as a department-wide strategic goal, and that certainly marks it as a topic of importance as we continue forward. We've also seen an emphasis on equity and climate change at the state level through the Healthy Environment for All Act, or HEAL Act, which defines environmental justice in state law and outlines how agencies consider community needs and environmental justice in their work. At this point, before I get into the meat and potatoes of the presentation, I just wanted to pause for a moment and see if anybody has any questions or comments. And it is a little bit hard for me to see raised hands, so feel free to speak up, or Julie, if you want to help point out when folks have a comment.
Anybody have any comments or questions at this point for Michael? Not seeing any hands, Michael. You can keep on going.
All right, thank you. With that, I'd like to take a moment and talk about why equity is important in what we do, and why most MPOs consider equity as an important consideration when they're looking at evaluating projects. So equity, as I mentioned, has its foundation in the civil rights movement. As I mentioned a couple slides ago, it arose in part out of a need to counter inequitable planning policies and outcomes as a result of that. For example, research coming out of the early 80s that looked at landfills found that 3 out of 4 hazardous waste landfills that they examined were located in communities where African Americans with families below the poverty line made up at least 26% of the population. In 2013, a study on the size, distribution, and demographics of populations living near high volume roadways found that poorer and non-white communities were disproportionately represented near high traffic volumes and densities. Earlier research also found that potentially vulnerable communities, in particular racial minorities, were disproportionately represented adjacent to freight corridors. And in 2012, the National Park and Recreation Association found that non-white and lower income neighborhoods are 50% less likely to have a recreation facility in their community than whiter, higher income neighborhoods. And those are just several examples from all of the research that's out there. Taking it a little bit closer to home, a couple slides ago, I had a bullet that mentioned redlining and lowest cost land acquisition. So the map on the left side of this slide and the prior couple slides is a section of a redlining map from Spokane dated 1929. I don't know if you can see the date on the upper right-hand corner of that picture, but it's there. This was provided by the Mapping and Equality Project from the University of Richmond. You can't see the whole city, but you might be able to make out in the red color some familiar areas, such as parts of East Central and Hilliard, for example. So this map was meant to govern investment in property, and that red category indicated that those areas were, and I quote, hazardous to capital investment. So this is the type of thing that systematized different forms of discrimination and helped set up these negative feedback loops that communities all around the country, frankly, are still feeling today. And here in Spokane, the concept of equity is extremely relevant. Spokane County is home to many potentially disadvantaged residents from all backgrounds and walks of life. In terms of median income, our planning area includes some of the poorest zip codes in the state. And we're home to a higher proportion of low-income residents than either Washington State or the United States as a whole. Yet our housing prices continue to rise while vacancies are low. In that sense, equitable transportation is important for us to provide a fair and resilient foundation. Equitable growth is important for the region's economic future. For example, access to jobs, improved levels of employment, access to active transportation and recreation, such as facilities for walking, biking, scooters, and access to parks, could improve quality of life and also even health outcomes. Equity is important to understand and mitigate possible impacts on vulnerable or potentially disadvantaged communities. And equity planning, importantly, also emphasizes the need to tailor outreach to communities that are potentially a bit harder to reach. So equity implies fairness, impartiality, and justice as a concept, but to achieve and sustain equitable outcomes, equity has to be looked at as part of a system. It has to be looked at as part of a structure. While equality is a term that also implies fairness and justice, it often comes loaded with the assumption that everybody is starting from a similar starting out point or baseline and that people all have the same or similar needs. So the next couple slides, starting here, refer to a couple different ways that we can look at equity. For starters, geographic equity refers to a fair distribution over space or with regard to geography-related needs. Unfortunately, we still live in a world where we live has a direct impact on our ability to access health, safety, and opportunity. Also big in terms of geographic equity is that urban versus rural divide. and the differential realities faced by communities in terms of economy, infrastructure, and access to services. Other potential disparities that are worth mentioning, such as the distribution of active transportation facilities, transit stops. Those are the things that we might be looking at as a transportation agency. Cities that deal beyond transportation might be looking at things like distribution of shelters and housing for the homeless, places where folks can get food and access health services and all sorts of other things. That's geographic equity. Racial equity is an important lens, of course, looking at equity through the lens of race. I'm assuming most of you are familiar with the legacy we have in our country with regard to slavery, Jim Crow, and other forms of systemized oppression on the lines of ethnicity and race. The redlining maps that I showed a minute ago, which were intended to guide investment, were influenced by racial composition as one of their inputs in determining those categories. So in a sense, that's just another example. Racial equity aims to provide all individuals, regardless of race, a true equal opportunity in education, employment, and in society at large. That often means looking back at root causes such as policies. For racial equity, one of the ideal outcomes would be that we could collectively no longer look at race and see it as a statistical predictor for certain outcomes, for example. So social equity can mean a wide variety of things. And talking about the legislation earlier, I referred to the ADA and Age Discrimination Act. I have several bullet points on this slide: age, income, disability, English ability, but that's a non-exhaustive list, especially for folks who are looking beyond transportation. For instance, the city of Oakland includes gender, sexual orientation. As a transportation agency, we're of course focused on transportation, and social equity in terms of the transport system means a safe multimodal network where all have access to the benefits and where the burdens are not disproportionately concentrated. So with that, I will circle back to the unified list. On last year's unified list of regional transportation priorities, we had a single checkbox with the criteria: was the project developed with a main emphasis on benefiting an area of potential disadvantage? And then unpacking that checkbox a little bit, we were looking at two analysis questions. So does the project increase transit or active transportation access, service frequency to potentially disadvantaged areas, or does the project incorporate appropriate countermeasures to address existing safety issues or contribute to STA meeting adopted public transit safety targets in areas of potential disadvantage? So I'll come back to that here in a minute, but before I get to the questions at the end of the presentation, I do want to look back in time a little bit to 2021, because I mentioned areas of potential disadvantage, and that research or analysis came out of Horizon 2045. So as part of Horizon 2045, we engaged in an equity analysis. In that, we looked at 6 key indicators of potential disadvantage. Those 6 indicators being low income, minority status, limited English proficiency, lack of access to vehicles, elderly and youth, as well as disability status. On a previous slide, I showed the Horizon 2045 regional profile with regard to those 6 indicators. And for each of the 6, we were comparing the prevalence to each census tract with the regional average. And then for minority status and low income data, we also were looking at the block group level for a bit of a finer review. From that analysis, we scored each category and identified areas of potential disadvantage within Spokane County. The redder areas scored well above average in terms of potential disadvantage, while the orange areas were above average. And IPD refers to the indicators of potential disadvantage, and just for clarity, APD refers to the areas or the geographic areas that are being pointed out on the map. Another important document from 2021 that I want to talk about just a little bit is our update to the public participation plan. As part of the PPP update, we increased our focus on outreach and public engagement, notably emphasized the need for tailored outreach to historically excluded and potentially disadvantaged communities. The plan update, which was approved by the board last December, also developed a set of goals and strategies for implementation. And additionally, to go along with that, we developed an internal facing engagement strategy tool to help staff with guiding our engagement efforts for moving forward. Another important ongoing effort, which I brought to the board and committees in January and February, is our effort to develop an equity planning framework. I'm not sure why the title on this slide is faded out, but hopefully y'all can read it all right. It says Work in Progress, Equity Plan Framework. So to do this work, we recruited a working group of our committee members, TAC, TTC, as well as a board member, Kelly, who's with us today, to meet monthly with SRTC staff in developing the framework. The working group also heard from guest speakers from other MPOs. We looked at some materials from other MPOs to help complement research that SRTC staff is doing. And we're hoping to hear from community representatives this summer. I presented a draft of what the steps would be to establish this framework earlier this year. Just to very briefly review them, we're currently in that first bullet, which is that we're establishing a wide range of potential tools and strategies that are out there that could be considered among potential recommendations. But that next important step, a key step as we move forward, is going to be honing in on what's really going to be effective here in our area, what is reasonable for our agency, our planning area, and then to develop a more specific set of recommendations, which will of course come back to the board. And we'll be coming back to the board with an update in July on the equity planning framework. To the TAC and TTC, that will be towards the end of June, when we'll be coming back to you with that update. And then this fall, we'll be reviewing our options, drafting recommendations, and we'll come back to you later this year with a draft document, and more to come later this year. All of that said, coming back to the unified list criteria for equity as they pertain to this discussion and to the unified list for 2022, how else could MPOs look at equity? Well, for example, we could be looking into acquiring origin and destination data to look at trips from areas of potential disadvantage to key destinations such as employment areas. We could be differentiating our equity criteria by different project types, or we could look at investment by dollar, by project type, or by areas, so that we track dollars going to the areas of potential disadvantage. Just as a reminder, again, our 2021 unified list utilized a single equity checkbox with 2 questions, which I have included in this slide on the bottom right-hand side. And so this is where we're at right now. This is where we were at last year, but we're investigating other ways that we could look at equity and how ultimately it should weigh in with all the other factors that we have when we evaluate projects. I do have one more slide, but because these are some big questions, I wanted to pause just for a discussion on the question here. Are there any potential changes that we could make, or are there equity related criteria that could make this process stronger?
Any board members with any thoughts on the question posed by Michael here?
This is Mayor Cooper. I have one question. I don't know if it will make the process stronger, but it would make it stronger for Medical Lake. I noticed on your map that it didn't look like Medical Lake was included in the assessment. So either the map was too small and I couldn't see that, but it looked like Medical Lake was not included in part of your data gathering. Is that correct?
With regard, are you referring to this map? Just for my clarification, the areas of potential disadvantage?
Yes. That one there. Yes, sir.
Absolutely. Medical Lake was included, but did not probably score for that aggregate indicator score as above average. Although the West Plains did have some census geographies at that time with Horizon 2045 that are adjacent to Medical Lake that did score. I don't know if that answers your question, although.
It does a little bit, except that if Medical Lake was included, I'm surprised it doesn't score, because we have a developmentally disabled hospital, Lakeland Village, and we also have Eastern State Hospital for, mentally ill, and they count as some of our demographic and our population. So I would ask you take another look at Medical Lake as you're gathering your data. Thank you.
Absolutely, absolutely, and that's a great point and provides me some clarity. I would imagine that because many of those folks are classed as institutionalized population, that has some effect on the census data, where a lot of the population groups that are used for the tables might be of the total non-institutionalized population. And so that would systematically say, you know, that folks staying at the Eastern State Hospital, for example, might not be included in that data. And that's why we might be seeing that omission. But I really appreciate the feedback. And that's certainly something that SRTC can go back and look at.
Thank you.
Comment. Thank you, Mayor Cooper. Ms. Charlene Kay, I see you have your hand up. You have the floor. You have a question?
Yes, I do, Mr. Chair. Michael, thank you for the comprehensive presentation, very comprehensive. In regards to your question that you asked, whether or not there's opportunity to explore other areas, in recent state legislation, RCW, I believe it's, let me see, I have it right here, 70A02, there's definitions regarding environmental justice and equitable distribution. And in alignment with that, I was wondering if SRTC could consider cumulative and legacy impacts and effects and evaluate whether proposed projects will mitigate or address legacy issues. And then also rolling in health disparities, that kind of rolls in with legacy health issues that that we see occur across the state of Washington because of past transportation and other improvements. So that would lend itself to the new health disparity tool that Department of Health has just recently published and is still updating that effort to identify communities that have significant health issues related to the built environment.
Thank you, Shar. Yeah, that's excellent feedback, and good to bring up the new tools that the state has put out. That's certainly something that we didn't have available to us a few years ago, which allows us to look at some of that statewide data like health disparities and potentially make that actionable in how we look at projects. So thanks for that great feedback, Shar. We'll definitely look at that.
Yes, thank you. Ms. Kelly Fukai, you have your hand up.
Thank you. Just a quick question, I guess, on the application of the questions related to equity. Currently, we're doing that sort of on the back end, right? When all the projects are submitted, or is there now questions on the application of projects that will encompass these? So will the municipalities submitting or the agencies submitting have to provide that data to you, or is that something that SRTC is going to do on the back end? I guess I'm part of my concern is resource wise and all those things, access. How are we helping support our agencies in their submittals to make sure that they're able to capture that data for their projects?
Absolutely. It's my recollection that last year these questions were largely answered internally by SRTC based on our GIS analysis and looking at the project type, looking at the applications. I don't know, Eve or whoever is maybe more senior in the unified list process wants to speak to the process this year, but I would imagine that there's no concrete request at this time to put more work on the agencies to do this analysis, although as we necessarily go through a competitive process, I would imagine that agencies that are willing or able to look at equity and to maybe build narrative or justification or understand what projects in their jurisdictions are going to benefit equity would probably benefit them in the process. But I guess just to answer your direct question, I think this analysis is done by SRTC, if that answers what you're getting at.
Yeah, no, that's very helpful. And I guess I think for the board members, I've been participating in the process, and what I'll say is we're on a journey. We're learning as we go here, and anything that you all see in your circles and work related to equity, I think it would be great if you'd be willing to share with us. As Michael's indicated, we've been hearing from other MPOs and other agencies across the state, and quite honestly across the country, as everyone is starting to embark on this journey and learning from each other, best practices or things, rocks in the road that we're uncovering as we go about this process. I think it's really helpful. So I just invite all of you, even if you're not participating, directly on the committee, please bring those things to us that are helpful in informing the work that we do. This is the start. We recognize we're not answering all the questions we need to answer and that we're going to miss some things. So I just, again, I encourage all of you to be engaged in the process and listen with that focus as you go about your work in other areas and see if we can apply that to the work that we're doing here.
Thank you.
Kelly. Eve, did you have anything you wanted to add?
No, I think Michael got it correct. It was really a blend of working with the jurisdictions on answering those questions and then SRTC looking at the data to support those answers.
Very good. We're still asking if any board members have any other equity-related criteria changes they want to make or suggest to make this process stronger. Any other thoughts, comments? Very good. Lois.
Just one more. I want to thank Shar for speaking up. She's really kind of the resident expert on equity and transportation right now, and she's a big help and a wealth of knowledge. I know all of you are dealing with these sorts of issues within your own respective jurisdictions. So any of the successes or challenges or information that you can bring back to SRTC, again, as the question says here, that will help make our process stronger, please do. The question that Kelly just asked also touches on the idea of right now we're applying all of this screening to projects that are already sort of in our process. But what we have not done is use some of these to actually identify projects through a needs planning exercise. And we've had a number of conversations about that, as well as other potential work activities in the future, but moving to a needs planning exercise of our transportation system where this might actually help develop some projects that might not be on somebody's radar screen yet. So I would ask everybody to just be mindful of that and see how we can move forward to identify opportunities in addition.
Good. Thank you, Lois. Michael, is there any other input you wish from the board members at this time with regard to equity?
Just one more slide here with a few open-ended discussion questions, and whether we get feedback today or whether folks want to reach out to me at a later time. But we just wanted to leave folks with these thoughts, namely, how are we defining success in terms of equity and what does that look like? And then working backwards from that, how could we measure that? And then again, like I mentioned earlier, should we be doing more to address the different needs of urban versus rural projects as it comes to equity? Of course, we'll continue looking to state and federal guidance as that develops and keeping an eye on the HEAL Act implementation plan. But I just wanted to leave the board with these questions